Foot is the most neglected and overused part of the body. Foot problem is a common issue that is often neglected. For people with diabetes, however, the possibility of incurring even a common foot issue can lead to infection or serious complications, and even sometimes amputation. As a precaution, it is important for those with diabetes to take preventive measures, including making seasonal weather adjustments. With an already compromised system, patients with diabetes are prone to poor blood circulation and nerve diseases in their extremities, especially in the leg and in the foot. As such, it is important that they don't solely rely on their senses, but instead make provisional basis on factors such as change in climate to help maintain healthy feet. Why the increased risk associated with diabetes? First thing, nerve damage or something called as neuropathy. High blood sugars and varying sugar levels, even spikes in sugars, can lead to damage of your nerves in your feet, leading to numbness, tingling, pain, and sometimes loss of sensation. This can make it harder to feel injuries and increase the risk of complications. The second factor is reduced blood flow. Diabetes can narrow blood vessels, reducing the blood flow to your feet. This can impair wound healing and make infections more likely. To help patients stay healthy, here are some diabetic foot care tips. Keep your feet dry. When it comes to your feet, rain and slushy weather have something in common. They cause dampness. Moisture collects in between the socks, your feet and the toes, and can form bacteria which can lead to an infection. Wash your feet daily a couple of times with water. Avoid using excessive soap or some sort of washing agent. Dry your feet with a towel, especially between your toes after washing. Next, an important factor is moisturize your feet. Use a moisturizer daily to keep the dry skin from itching or cracking. But do not moisturize between the toes. That could encourage a fungal infection. Poor circulation associated with diabetes often decreases the moisturizing glands of the patient's feet who are diabetic, leaving their feet more susceptible to dryness and infection. Coming to the next factor, avoid direct heat to your feet. A safer way for people to minimize diabetes is to minimize the dryness and chance of burns in their feet. Keep them away from direct heat. With the numbness caused by neuropathy, diabetes patients may not feel when their feet are burning. As a result, they experience second or third degree burns, which can lead to serious foot problems and infections. So, patients with diabetes should not put their feet in hot water. They should test the bath with their hands before keeping their foot inside. Also, using warming aids on their feet like heating pads is a big no-no. Walking barefoot during summer in hot areas, especially during temple visits, can be dangerous in many diabetics as they do not recognize the burns immediately. They take a couple of days for blister formation and then infection to occur. So be very careful as these burns can lead to a lot of infection and foot morbidity. So try and avoid visiting temples or any barefoot walking during the hot season. Get the right shoes. This is the most important factor. Patient with diabetes should wear a slightly loose fitting shoe with a supportive sole. Wide toe box to reduce cramping is of significance. Avoid high heels and tight footwear. Replace worn out footwear or shoes regularly. Next, coming to nail care. Cut your toenails straight and never cut them on the edges and try to curve them. This prevents ingrown toenails and further infection. Do not cut them too short. Protect your feet by wearing socks or stockings to protect your feet from injuries. Change them daily. Consider using socks from moisture-wicking material. Avoid barefoot walking. Never walk barefoot, even indoors. Here are some additional tips. Thoroughly inspect your feet daily using a mirror to check the bottom and the sides and in between the toes. Look for any cuts, sores, blisters, redness, or any changes in color in your feet. If you have any concerns about your feet, do see a doctor right away. Avoid smoking. Smoking causes worsening of circulation and neuropathy and increases the risk of foot issues. Be cautious when using hot or cold treatments on your feet, as they have suffered from neuropathy, so hence sensation in your foot will be low. If you have diabetes, it is important to keep your blood sugar levels in control. The variation in blood sugar also is not a good sign. You should have a reasonably stable blood sugar through the time. Exercise regularly to improve your circulation. To conclude, patients with diabetes are highly sensitive to foot issues. They should see a surgeon regularly as a preventive measure. With proper foot care, patients with diabetes can lessen their chances of incurring a foot issue. With regular visits to the surgeon, you can notice any alarming changes in the patient's feet and provide appropriate treatment. I hope this video was informative. I'm Dr. Rajiv Pulagura, consultant surgeon and podiatrist. Thank you.